Hi, I'm Nicole Cutler, a licensed acupuncturist and holistic health advocate. I'd like to talk a bit about the symptoms of hepatitis C. Hepatitis C often goes undiagnosed for many years because it rarely causes symptoms in its early stages. Even someone who has been infected with hepatitis C for decades may not have any symptoms until they have reached advanced liver disease. Even then, the symptoms usually come and go. When symptoms of liver disease finally do surface, they can range from mild to severe, with the most common symptom of hepatitis C being the universally vague problem of fatigue. Some other common symptoms of hepatitis C include intermittent abdominal pain. The liver is on the right side of the abdomen, just under the rib cage. When the liver is inflamed, it can cause pain or discomfort. However, some people don't actually experience pain, but they do feel a vague sense of fullness over their liver. Abdominal pain from hepatitis C does not need to be over the liver. It can also be referred to other areas of the midsection. Since the liver is an integral part of the body's digestive system, hepatitis C can cause reduced appetite, weight loss, nausea, or vomiting. Depression also commonly accompanies hepatitis C infection. Experts have proposed a range of reasons explaining why those with hepatitis C get depressed. While there is no single, mutually agreed upon reason, there is no doubt that depression is very common with hepatitis C infection. Jaundice usually does not occur at the beginning of hepatitis C infection. However, this characteristic yellowing of the skin or whites of the eyes is a sure sign of advancing liver disease. Another indicator of advancing liver disease can be seen in the toilet, in the form of dark-colored urine and pale or gray-colored stool. If hepatitis C has already caused a permanent hardening and shrinking of the liver, known as cirrhosis, the following symptoms may be a sign of this complication. Fluid retention can cause swelling of the belly, also known as ascites, swelling in the legs, or the entire body can retain water. Skin itch. When the liver is unable to filter toxins out of the blood, it is common for the skin to itch. Bleeding varices. Caused by a high degree of pressure in the liver, coughing or vomiting blood can indicate bleeding varices. Confusion, hallucinations, or extreme sleepiness can be due to toxins building up in the blood and affecting the brain. Because cirrhosis and its complications can be dangerous, especially vomiting blood or confusion, symptoms of cirrhosis must be addressed immediately. While the problems discussed are the most commonly experienced symptoms of hepatitis C, they are certainly not exclusive. In recent years, physicians have come to acknowledge extrahepatic symptoms of hepatitis C, where problems arise outside of the liver. In addition, those undergoing medical treatment for hepatitis C are prone to the medication's side effects, which can be quite severe. As you can see, the symptoms associated with hepatitis C are vague and rarely prompt people to visit a doctor. In fact, approximately 80% of those newly infected with the virus won't have any symptoms at all. Unfortunately, when the symptoms are severe enough to urge someone to see a doctor, hepatitis C has usually progressed to advanced liver disease. Since so many people live with this virus for 10 or 20 years without symptoms, anyone unsure should request a hepatitis C test. That way, if they are positive, they can take the steps necessary to prevent hepatitis C from progressively damaging their liver.